in response to the qualitative work that we wrote a leaflet that was in response to the qualitative work that Ala had done with the families on the Turkey-Syria border. And a wonderful charity who was distributing bread from Turkey through into bakeries in conflict areas of Syria said that they could deliver the bread wrappers, the bread in the leaflets in bread wrappers. And so we put in questionnaires and pens with leaflets. And what was really remarkable was that the charity was able to distribute 3,000 leaflets in 2 days, specifically to families with children who were living in these conflict areas. And we gave out questionnaires in the package, and we had an almost 60% return rate, which is an extraordinarily high level of return for questionnaires. Parents brought back their questionnaires and dropped them into boxes when they came for their next bread delivery. And to our astonishment, really, they sent back really positive ratings of the leaflet. They said it was really useful. And they also sent back very positive comments saying, thank you for remembering us. It's good to know somebody's thinking of us. They talked about their challenges and they suggested improvements or what they would like to see. And that's been really has informed our later work. But these resources now have been translated into many different languages. Yeah, dig on to the next one. And are now the links are distributed by a whole range of different organisations, including, for example, the Royal College of Psychiatrists, who distributed it in relation to Ukraine first and then Pakistan, by the Welsh Traumatic Stress Wales, and many other organisations. And because the leaflets are available in so many different languages, we've been able to get them out very, very quickly, and people have been willing to volunteer to translate them very, very quickly as well. Next, please. And they form part of the Ukraine Parenting Response Project, which was University of Oxford, UNODC, WHO collaboration, which reckoned to have reached over 11.5 million people who were experiencing the Ukraine crisis. So it shows the level of reach that's possible. Anna talked about this pyramid, so I don't need to talk about that. But to give a little more information about the top of that pyramid, teaching recovery techniques plus parenting, I think this is an example of where we can work with facilitators who aren't necessarily psychologists, who aren't necessarily, who don't have mental health training, but who are able to participate in programs to and provide facilitation of really closely written and carefully prepared resources. So what we did with teaching recovery techniques, as Ala said, which is a Children of War Foundation program, is to combine it with parenting elements, which really are absolutely consistent with the others in that UNODC pyramid. So with the leaflets, with the conversation groups, with strong families and so on, there's a common thread running through all of those different programs. So we drew up a set of 5 parent sessions, which we ran alongside the 5 children's sessions. Next, please. And we piloted this, first of all, in Turkey with refugee families who had come out from Syria, and then went on to run a randomized controlled trial with support from UNODC and the Children of War Foundation in Lebanon for families who had escaped from Syria. Next, please. And here it was teachers who were already trained in TRT. We trained them with the additional components of the plus parenting components. And what's really striking about this is that there were significant improvements for children with TRT, but also significant additional improvements for children and caregivers across a range of the measures. And so if we can look at the next slides, I'll just give you some examples of what we mean by this. So the children had completed the CRIES measure, which has 3 subscales of intrusion, avoidance and arousal. And here's an example in relation to intrusion, which is the pattern that we saw on these graphs is absolutely typical across all three: intrusion, avoidance, and arousal, which is that the children in the TRT group improved significantly more than the children who were on the waiting list. But the children who had TRT plus parenting, so their parents were also participating, showed the quickest reductions and the greatest reductions. And we saw that again and again in relation to their anxiety and their depression as well. So adding the parenting component really seemed to help the children. Next, please. We also measured what had happened to the parents, and what we hadn't really anticipated was that the parents who were taking the TRT plus parenting, they reported greater reductions in their parenting scale scores, also in their depression, anxiety, and their stress levels, and on their own ratings of the impact of events, so their revised total score, so their trauma measure as well. So what we're seeing is additional improvements where we have a combination of a children's trauma-informed program, recovery program, plus a parenting program, and putting them together then helps, I would guess, the whole family. It certainly helps the child and the parent that we worked with, and it's likely that it can have impact for the rest of the family too. Next, please. I want to move now to talk about something a bit different. And I was really interested to hear Mina talking about parenting and serious mental illness, because this is an area that I've also been very interested in over a number of years, because parents who have serious mental illness have been so very neglected by the research, by services as well. And I think partly because certainly in the UK, the way that children's services and parent and adult services are so separate means that there's a lack of recognition really of the importance of the interconnection between the two, parents' mental health and children's mental health. So that one of the joys of working at Manchester has been working alongside very large numbers of academics who are working on serious mental health difficulties, particularly psychosis. And I suppose it was natural that I would gravitate to working alongside them when I started thinking about parenting and serious mental illness. We know that children's needs often go unrecognised. Most of the research is on parenting and depression, particularly in the child around birth and in the child's early years. And there's much less on, for example, parenting with bipolar disorder or schizophrenia and psychosis. And I was one of a group that reviewed the literature in a review led by Penny B in 2014, which showed really how very minimal the literature is on community-based interventions for improving and maintaining quality of life for children of parents with serious mental illness. Okay, next one. I started working with Steve Jones, who was at Manchester, on trying to use parenting information for parents with bipolar disorder. And we worked in collaboration with Matt Sanders and the Triple P Positive Parenting Programme to put together a joint intervention. And we ran a pilot study, next please, which then went on to sorry, can we go back one? Yeah, so we ran a pilot study which seemed to be helpful for parents, and then we ran a much bigger randomized controlled trial. It was all online, and what we saw was improvements in parents' mental health through using an approach that focused on their children. So yeah, let's go on to the next slide. So we then took this into the field of psychosis, and I've worked with particularly Lindsay Gregg, Anya Witkowski, and the studies were led by Lauren Wolfenden, who did a PhD with me. And she did a very interesting case series where she tried the Triple P positive parenting program, a self-directed version. So all the parent gets is a handbook which runs through session by session how to change your child's behaviour through positive parenting. And what Lauren did was she identified families where there was a parent with psychosis, and after doing lots of baseline measurements, then shared the booklet with them. She didn't teach them about parenting, she just sat with them and helped them read through and understand the different components of the parenting programs. And so she was she was just acting as a guide. So she was doing that. She was a psychology graduate, but she wasn't trained specifically in parenting approaches or in intervention. She was going there as a helper, and that was her role. Next, please. And so this was a supported self-directed intervention using the Triple P self-help workbook. And she worked with 10 mothers. We did engage a couple of fathers, but they dropped out very early on. They had children aged between 3 and 10 years. They were all experiencing psychosis. 6 with schizophrenia, 4 with paranoid schizophrenia. 9 of them were single parents, 9 of them were unemployed, and all of them were struggling financially. So these were parents who were really having a tough time of it. And 5 of them completed all 10 sessions that the workbook took them through. And then there was follow-up at 3 and 6 months. And we saw some really interesting findings. So the iBug Child Behaviour Inventory was our main outcome measure. And as you can see, the intensity scores really generally show a trend of dropping down. So even for the parents who dropped out, most of them, you can see that the graphs are going in the right direction, and parents are reporting their children's behaviour as much less problematic by the end of the intervention in the follow-up period than they were at the beginning. Next, please. What we hadn't expected but were very excited to see was the changes that there were for at least some of the parents in their mental health difficulties. So we used the CIRAT's hallucination score, and you can see for some of them there's a really quite marked drop in their scores for hallucinations. So taking part in a parenting intervention has helped their mental health. The next one. And similarly for delusions, you can see the downward trend for most of the parents. So I think that this reinforces really the notion of, first of all, helping parents to parent more effectively, which is going to reduce their stress levels. A lot of the parents at the beginning said that were saying that parenting was one of the biggest stressors and one of the greatest causes of their concerns and their day-to-day hassles. And Lauren undertook some qualitative interviews afterwards, and there was a really nice quote from more than one parent actually saying, you know, I wasn't a mum, or I was a new mum afterwards, which really rang bells for me with the parent that Annie Lehner had interviewed in Panama, who said, you know, I used not to know what to do, but now I know what to do. And a feeling that they've changed, that they're able to parent differently. And so instead of feeling hopeless and lost and a bad parent, they felt better afterwards. They really liked using behaviour charts. They found descriptive praise and consistency with ground rules really helpful. They said that they felt more actively engaged and described many positive changes. They said they looked forward to spending time with their child rather than trying to find alternative care. There was one lovely comment about how one of them was taking her children to the pictures now, and that she'd not taken them to the cinema before. And some described it as transformative. some of them saying they felt calm, they felt like a new mum, they were smiling, laughing, coping, and that their children were happier and more affectionate. So you can really see a positive spiral that has now started to develop within the family. They said they looked at the book when they needed a reminder. That's exactly what the parents in Anne Elena's study in Panama said. If they couldn't work out what to do, they just went back to the book and they looked at it and they found it helpful. And the parents said that the support alongside the book was invaluable. And we now have funding to run a much larger study of this. So Lindsay Gregg is leading on that. So let's move to thinking globally and how we can deploy these sorts of approaches and how these sorts of approaches fit when we're faced with something like the terrible, terrible floods in Pakistan, the earthquakes that affected people who had already been affected by the Syrian conflict, for example. How can we use these approaches to help? And I think what I hope I'm demonstrating so far is that we can have approaches that are really relatively light touch or don't need experts to provide them, which parents really value and which do seem to make a difference to their parenting. It does seem to help to strengthen them. The next, please. And I really like a model which is based on the original Bronfenbrenner model of ecology and bioecological model of development, which Ereklian and Agar reviewed in, I think it was 2021. And they talk about mental health and psychosocial well-being of refugee children and how we can think about the child, we think about the familial factors, and then how important it is to think through community factors and institutional and policy factors. And I think that one thing that we underestimate at our peril really is the importance of those institutional, national and international actors who can make such a difference for families. Next one, please. Sorry, could you just go back one? Yeah. And I think we have a really interesting illustration of that that's come through in the Ukraine conflict. And that is what a couple of authors have called the Zelensky effect. Next. And what Zelensky has done as a national leader, he has really encouraged Ukrainians to rally around the flag. He's rallied international opinion, and he's shown really clear, explicit values, which he conveys all the time through social media. Next, please. And I think this is a different experience which you can compare to other armed conflicts and displacements, for example. In many cases where children are displaced by war and conflict, the leadership of the country shows little concern for their well-being, or may actively, that shows little concern for their well-being. Whereas in Ukraine, they've shown enormous concern for children and families. There's been tremendous reach of communications and engagement with the population wherever they are. There's central organisations to make sure children can access education wherever they're living in the world. And there's a really clear sense of home and a welcome waiting back in Ukraine as soon as possible. And I think we really need to take these sorts of levels of these sorts of national issues into consideration when we're planning intervention, and also when we think about research, because we know that conflicts and emergencies and flight aren't going away, and we need to really build communities that have knowledge and strengths. There was I was reading a Médecins Sans Frontières leaflet that came through the door yesterday, and there was a quote from somebody working in Ukraine saying, "Oh, they've underestimated the resilience of our grandmothers. You know, our babushkas are really important figures." That sense of strength that we can help, countries can really help with. And there are different stages where we can really, through our actions, help to build strengths. Before there's some sort of conflict, or when trouble is brewing, Parents tend to become very anxious, and they become particularly warm and overprotective of their children. That's a really prime teachable moment for families, when it would be possible to really work on ways of building resilience and preparing families for what might lie ahead. During conflict, families need specific advice through conflict, like displacement and resettlement. And thinking about resettlement, it's not just all the things that happen in the healthcare services and social care services and educational services and so on that families will encounter where they then settle. There's the additional element, which is when fathers, for example, let's think about Ukraine, when fathers who've experienced military conflict may return to the family showing signs of post-traumatic stress, which can impose a whole additional layer of pressure for families who are trying to already cope with a whole range of different difficulties. But I think to answer the questions that I set out at the beginning, we really can reach people in low resource, stressed and humanitarian settings. I hope we've demonstrated that. We can reach people in complex emergencies, even in the middle of earthquakes and in conflict zones. Using the right approaches, we can be timely. If we think about what sorts of resources people need, we can get those in there. We can share information and skills in cost-effective ways, and we can train facilitators who don't have a background in mental health and still see good, strong results in our research. We can combine approaches, and I think there are many examples of that. I mean, learning through play plus trauma-informed programs for children. We can reach underserved people. We've been able to demonstrate that as well. And we can do this across diverse contexts and have benefits for children and parents and build resilience. And we can help families in many diverse settings around the world. So thank you very much to you all for listening, and thank you very much to all my collaborators, all the wonderful people I've worked with on in developing and evaluating these resources. Thank you.
Rachel, thank you very much. I can see why